Fatigue is an incredibly important topic for patients with MS and for their families. Fatigue is the single most common symptom in multiple sclerosis. The difficult portion of it, however, is that it's also an incredibly common symptom in many other conditions. So when we ask about fatigue with MS, the first thing that I always want to try to accomplish is to try to determine what are the potential sources of fatigue in that patient. And so we spend a great deal of time talking about sleep. Is there sleep interruption? Does someone have a primary sleep disorder such as insomnia, or do they have a primary sleep disorder of interruption of sleep such as obstructive sleep apnea or periodic leg movements of sleep or REM sleep disorder or other things? Do they have maybe secondary causes from MS that cause sleep interruption? So, for example, pain. Does pain awaken people? Do spasms or spasticity awaken people? Do they have to get up to urinate at night multiple times? Or even perhaps do they have their spouse awaken them at night because of their sleeping problems? So primary sleep problems or secondary sleep problems are both very important. In addition, a lot of patients have poor sleep hygiene. That is, they may not do all the things that you should be doing in bed, only in bed. So, for example, do they have other activities, reading, watching television, eating pizza, or other things like that that perhaps disrupt the sleep cycle? In addition, a lot of patients, and a lot of our patients especially, might nap during the day. And that might have a significant impact on their ability to get long restorative sleep at night. Another issue from the point of view of fatigue overall is that we use a lot of different medications that may have an impact on how people feel and function. A lot of these are what we call psychoactive medications or sedating medications. And the patients need those for pain or for spasticity, but they can also have the negative impact of making people feel really just drowsy and not very functional. In addition, then mood and depression and other things like that may play a role in how people feel with regard to their overall function. And those are very important. Fatigue is a very important symptom for patients with depression and other mood-related conditions. In addition, a lot of our patients get deconditioned. They don't have a chance or an opportunity, or they can't exercise to the same degree that they used to be able to exercise, and that might have a significant impact on their ability to function, as may comorbidities such as hypertension or perhaps obesity or perhaps diabetes may also limit their ability to exercise. So all of those things play a significant role in how people perceive fatigue, and the fatigue may be both mental as well as physical. But what we think of as MS-related fatigue is often that our patients awaken and do well in the morning, but then as they go throughout the day, they tend to sort of run out of gas and they don't feel quite as functional throughout the course of the day. When we've ruled out all of the other causes for potential fatigue and we're left with something like that, we tend to blame the MS specifically. So our approach to treating fatigue is to first try to identify, are there sleep-related issues, are there sleep hygiene-related issues, are there polypharmacy or multiple medicine issues, are there comorbidity issues, and for all of those different things, we try to treat those to the maximum degree possible. And if we're able to successfully do that, we can oftentimes just get people to feel and function better just by changing those things, perhaps limiting naps, perhaps changing the way people go to sleep and how they sleep can have a big impact. But when we have gone through all of those things and we haven't been able to eliminate all of the different causes of fatigue, and we ultimately say that MS itself is a primary cause for the fatigue, we'll often use a variety of different medications to help people. We want to try to avoid the cycle of having patients take various medications to go to sleep at night and then other medications in the morning to help them function. But at the same time, sometimes that's what we need to do. Most importantly, use the least amount of medications, but to use things such as amantadine, such as modafinil, such as any of the stimulants, such as methylphenidate and some others. We try to use those as little as possible, but use them when they're needed, and sometimes they're extremely helpful.